MS Plus acknowledges the traditional custodians of the land this podcast is recorded on, the Wurundjeri people of the Kulin Nation. We pay our respects to their elders, past and present.
This is the MS Boost, the stuff you need to know from the people who know it.
Hi, my name's Jodie Hudson. I'm the Executive Manager of Client Engagement and Wellbeing at MS Plus, and today on MS Boost I am delighted to be speaking to Dr Cassie Nesbitt about a topic that I think interests every single person living with MS, and that's about stem cell transplant. So we're going to get straight into it. Thank you, Cassie, for joining us. What is stem cell treatment and what's been your involvement?
So I'm one of the principal investigators at the Alfred Hospital, Melbourne, for stem cell transplantation. And with stem cell transplantation, it's essentially a way of resetting a patient's immune system so that you can switch the inflammatory component of MS off. It involves collecting a patient's stem cells, where you give them a lot of medications to stimulate their bone marrow. You then collect the stem cells from them, and at a later date, often weeks, possibly months later, you then give the patients industrial doses of chemotherapy to ablate their entire immune system. So you're literally destroying all immune cells, and then the stem cells are given to aid immune recovery so patients don't get the consequences of having no immune cells at all. And then the patient will repopulate their immune system, and it'll regrow from stem cells themselves, which is that they're not autoreactive. So the patient's cells that are attacking their myelin and their central nervous system go back through a process where they're ones that are the bad guys, so to speak, shouldn't repopulate. So it puts MS into remission. And then the patient should have no further inflammatory disease activity following that, similar to how Mavenclad or alemtuzumab also do an immune reset. The stem cells themselves, though, don't do anything to heal the central nervous system. They're not going to regenerate the damaged cells and fix the myelin that's lost. It doesn't have anything to do with central nervous system repair. It's literally just to help recover from such intense immunosuppression.
So it's essentially just a wiping out of your immune system and a whole new rebuild and reboot using your own stem cells, because they're the cells that kind of generate the immune cells in the first place. Is that right?
Yeah, no, that's right. Yes, we do haematopoietic stem cells. So we're literally just targeting the blood cells, which is the immune system cells are the only ones that we're targeting. And the stem cells literally just help grow back those haematopoietic cells. They don't grow back like axons or neurons, glial cells. So they literally focus on that. And so unlike the conventional MS treatments that are available, that they attack the immune system at very nuanced points specific to MS, this is just hitting the whole immune system with a bomb and wiping out the whole thing to essentially start afresh.
Yeah, it sounds like a pretty intensive process.
Yeah, it is. So patients are very, very unwell. There's a huge risk of infections and complications. Often you can be in hospital for weeks, sometimes a couple of months. And I'm critically unwell. We've had patients in intensive care. It is a very full-on big process for patients to be experiencing.
So it can make you really pretty sick. One of the things that I guess is given lots of popular media and lots of noise in the MS community is accessibility to it. So one of the biggest questions is, she's having it, why can't I? So tell me a little bit more about that and how people can access it.
Yeah, so we're doing it at the Alfred, and there's a few other sites across Australia that are doing it, but it's purely a clinical trial setting. So I think that's what I'd really like to point out, is that the role of stem cells is becoming clearer with science, but it's still not really determined, and it is still a clinical trial. And we're in the process of working out who it works best for and who are the patients that are going to benefit from having the procedure. And that, I think, is one of our key things that we're trying to identify in our trial using data from other studies that have been published to work out who will benefit. And it's reserved for patients who are failing conventional treatment. So patients who've had inflammatory disease activity despite being on a highly effective treatment that's available here in Australia. And I think that's also the patients that are potentially going to benefit. It does just fix the inflammatory component of MS, so it stops the relapses and new MRI activity. the role of the stem cells and the whole transplantation in helping people that have MS progression who are accumulating disability without having relapses, the role of the stem cells is really unclear in that setting and not nearly as beneficial. So those patients don't get included in Australian studies because there's not a clear benefit. And then in Australia, we have a really fabulous Therapeutic Goods Association and Human Research and Ethics Committees who really determine that we have to practice ethical, good clinical practice and only include patients in trials who are going to benefit and the standard of care isn't working for them. So if somebody is able to have their MS controlled on a conventional available disease modifying therapy, there's actually no benefit to doing a stem cell treatment. You're actually just trying to achieve the same outcome. But the available medicines that we have in Australia, they've already been through that rigorous science and that rigorous safety outcomes and ongoing safety outcomes. So I don't think it's ethical to include all patients when the standard of care is so good as a comparator.
So it's not just the neurologists who are sort of limiting that, Cassie. It's the regulatory bodies that have a role in who gets access to this. Is that right?
Yeah, absolutely. If you want to do any clinical trials in Australia, there's a huge, rigorous group of different regulatory bodies, and they're fantastic. Like, it took us 12 months almost to get our project up and running, to meet all of their requirements, to make sure it was safe, to make sure it was ethical, to make sure it was great standard of care, and that everything was above board. And I fully support that process.
Yes, that whole making sure that it's safe is so important, and that the control element of it is not just within the neurologist's hands, but there's a lot more other factors to consider when they're thinking about trialling these. Would you still say it's experimental?
Yeah, I think it is. So we know that it works. I think there's been some trials that have shown that it works, but the role, I think, now is to work out who it's going to work for. Given that it is such a huge risk, you don't want to subject people to such intense procedures and risk of complications if it's not going to benefit them. So I think that we still need to work out when to use it, who to use it in, and also how does it compare to the high efficacy MS treatments, given that it's possibly not superior. So the latest research would suggest that it's actually on par with medications like Tysabri and ocrelizumab, but not necessarily superior. That's based on big database studies with propensity matching, which means they compare it to controls that are on those treatments. But I think just working out if it is superior or if patients would be better off on these other disease-modifying therapies, there's some current research in Europe doing big clinical trials. So hopefully that will give us a lot more information in the next couple of years with respect to that. Just with Australia as well, all the sites that do stem cell transplantation, so 2 in Melbourne and 2 in Sydney, we collaborate. We have a committee meeting once a month combined with haematology and neurologists from every single site. We discuss every case. If you don't necessarily meet the inclusion criteria at one site, the other sites will certainly consider that case. But it also collaborates so that your case is actually considered by a whole panel of experts, not just one treating doctor as well.
Yeah, I think that that's another testament to the concerns around the safety of what's happening, the degree of effort that people go in to ensure rigor, because from what you've said, there are lots of risks associated with doing this. And emerging data seems to indicate that it's about as good as what's already available in the other treatments as well too.
And it doesn't always work. I think there's plenty of people who've done the procedure and then gone on to have relapses. And then that becomes a very unknown, how should you best manage people after they've had a stem cell transplantation? How safe are the treatments that exist and what should we do is a grey area. But I think it doesn't always work. There is a chance it will fail. I've certainly witnessed that. And that's another thing that I think you just want to make sure you're giving it to the right people.
The right people, and possibly at the right time, I imagine too.
The right people at the right time, absolutely.
The aims are very much in MS treatment to give it for the right people at the right time. So what might be some of the other risks involved in the treatment as well? When you're thinking about it for people and going through all the risks, what are some of the things that you would talk to them about?
I think the main one is that, it's such a giant dose of chemotherapy that, as I said, you're ablating the whole immune system, and that then has ongoing effects. It has a huge impact on your heart, your lungs, your whole body system, that you can be critically unwell from a whole range of hematology adverse effects. And you can also get really severe infections, and you need to be very cautious about infectious risk for quite a long period afterwards. You can also wipe out people's vaccine responses, so they have to be revaccinated later on and so forth. So some of that protection also disappears. The second one, I think, would be that the chemotherapy will target all the rapidly dividing cells in the body, which also includes all the gonadal organs. So infertility is very common. We do a non-myeloablative regime in our study, which is a little less toxic to the gonadal organs compared to myeloablative regimes, which involves a lot more chemotherapy. But the rates of menopause, which is complete cessation of ovarian function, is about 50%. So there's a very real risk of infertility. Patients who are women of childbearing years in our clinical trial, we collaborate with the Royal Women's and they go through some fertility screening, often having to do egg retrieval, which is not a nothing process for them to do. And then there's often a cost with egg storage afterwards. And then if they don't resume having their periods after the procedure, you're potentially looking at IVF. And then I think there's a lot of emerging literature and outcomes looking at the effect of menopause and andropause for men as well, and how that can then also affect MS outcomes. And then, just to mention for men, they would have to do a sperm storage as well before going into the trial. But I think those long-term reduction of sex hormones in people is not without some effect, which is what is another big growing area in the MS community.
You talked a little bit about how effective it is and said in some people it doesn't work. Overall, what's the feeling in terms of effectiveness within your experience and also the group in Australia?
I think I'd say that it's pretty effective at stopping the inflammatory disease. Those breakthrough cases are rare. We've also seen people who've been in clinical trials from overseas or had the stem cell transplant overseas that have had some inflammatory activity recur sort of decades down the track. So it was a short-term remission, but not a permanent remission. I think that it is quite a highly effective therapy for the inflammatory component. But the effect on disability and accumulating disability, that more progressive or degenerative phase of MS, it's certainly not as effective in that situation. My experience would mirror the studies that have been published to date.
Because of the challenges of access in Australia, lots of people have chosen to go overseas in some countries where they're making it far more readily available. What have you seen when people come back, and what would you think about some of the risks associated with travelling overseas?
So I think just another point with that to make is that if you're somebody who we believe would benefit from a stem cell transplant in Australia, I believe it's available to you in a clinical trial setting at one of the sites that is doing it. If you are failing conventional treatment, you will qualify for the trials. Then we certainly see people go overseas to have these procedures, and the sites I'm more familiar with, which would include countries like Russia and Mexico, their methodology, I think, is sound. They do appropriate regimes for stem cell transplantation, and their treating teams are generally collaborative and do give us some information, but our follow-up care for these patients often extends for years, seeing both neurologists and haematologists, so they don't get that follow-up care, which I think is really crucial. As I was saying, you need to redo your vaccinations, and there's a lot to be considered in terms of infection risk and taking medication to reduce that infection after the procedure. That I would say if you do go overseas and do a stem cell transplantation, we are still so happy to see you. Even if you've gone against advice that was given to you, we will absolutely, unquestionably and without judgment, continue your care and to see a haematologist and neurologist for ongoing care if you come home. Patients that I've seen go overseas to have the procedure done have very variable experiences. Language barriers in healthcare when you're critically unwell can be unbelievably confronting for people, that it can be a really scary experience. Then even if the medical staff can speak multiple languages, the nursing staff directly in your care might not be able to communicate with you, and you're feeling really terrible. You might not necessarily be up to using translator apps, or the nurses might not have the time to give that to you depending on the site. So it can be it can be pretty traumatic for some people from what has been fed back, whereas others have had a reasonable experience. My concern with some of these centres is that And what's also been available on the media is that they give a lot of hope to stem cell treatment. And I think that if somebody has a neurological, which has a degenerative component, hope is something that can be manipulated. It's an emotion that I think runs really hot for people. And so my concern is that if you give somebody even a tiny promise of hope, you might go and take risks that you wouldn't normally take without necessarily understanding the benefits that might be made available to you. And often there's these astronomical expenses that are also associated. I just don't know from my experience and what I've seen that patients are necessarily cancelled through all of that with respect to risk and financial risk as well, versus what is realistic benefits.
Yeah, I think one of the messages that's really important is that the Australian neurologists really want to provide care and support and follow up for people without judgment was such an important term there, Cassie. And I'm aware that there's lots of databases wanting to track people's information. So one, it is available in Australia and it is in the clinical trial setting, but that doesn't exclude everybody. So it's worth asking about whether it's appropriate with your neurologist. I think that in my experience in the last 5 years, that conversation has really opened up now. There is much less judgment about it. There is acceptability about talking about this and opening it up. And it's really important to find that if you have concerns, you can talk to your neurologist about it and they will give you an honest discussion about what the risk is and also point you in the direction of where it's happening in Australia and that it is happening. Would you say that's true?
Yeah, definitely. I think the MS community in Australia is actually really small. Like there's not a large number of neurologists that specialise in MS and we know each other really, really well. So, you know, I'm so happy for other neurologists to send us text messages or emails like, can I just get your thoughts about this? Really happy for patients to be seen at the Alfred to do the counselling if they feel like they need some further input with respect to the role of stem cell transplantation. Our inclusion criteria is published on our websites and we're really happy to also share that with your treating neurologist or have the discussion with your treating neurologist so that they can then relay that information to you. But I think it is appropriate, one, for patients to be really engaged in their care and look at this and ask the questions. I think that's really great. I love it when my patients are that engaged and self-researching. And I think it's appropriate that we have these conversations and give the appropriate counselling and let people know like what we think other alternatives might look like for best practice in their MS care.
Yeah, unfortunately there are many alternatives available to people and from my understanding that are not only safer but also less extraordinarily interruptive into your life. Like it's every aspect of your life and it doesn't just end when you don't have the treatment and then go away and it's all over. Would that be true?
Yeah, I think it's about at least a 12-month course from like commencing the whole procedure, consenting to go into a trial, seeing haematology, the committee meetings, doing all the tests that are required. So you have to do lung tests, heart tests, liver tests, a lot of blood tests. To then, as I said, doing the collection and then doing the transplant and then the recovery afterwards. And sometimes you have to throw in there fertility preservation as well. It is generally about a 1-year turnaround to patients even starting to feel like their normal selves again. So it is very life interrupting for sure.
And my last question, where's your feeling that we're going to land with stem cells 5 years down the track? What would you say the future's going to look like?
I don't know. I really don't know. So I think it would be really great to see the controlled trials that are being done in Europe. That's a really high way to get evidence is through a controlled trial. So I think that will give us a lot of information. But then there's a lot of new sort of therapeutic approaches that are also being investigated with the disease modifying therapy world, especially ones that everybody's trying to find medicines that might help with progression. So that might become a more attractive option for stem cell transplant. And then there's also some talk about exploring the role of CAR T cells for MS. And so there's so much, I think, exciting stuff on the horizon that I don't really know the role of what the stem cell transplantation will show. I think that investigating it has given us a huge amount of insights into MS and best practice and how to modulate the immune system to get the best outcomes. And as you said, like right person at the right time. There's a lot of information there, but there's a lot of other worlds to be explored that I think it's really exciting. And that's why I love MS care and MS research. But yeah, I really don't know, and I hope to find out.
I'm sure that the Alfred team will be working very hard, and the rest of the teams collaborating in Australia. I think that's really important as well too. And I have a sense that treatment is going to get more sophisticated and more safe as an outcome. The more sophisticated and personalised you can get, the more likely you are that it's going to be safer and less interruptive into somebody's life than having to go through this extraordinary procedure. Thanks so much for going through that with us today. And as always, if you've got any questions, people can also contact MS Plus. So thanks, Cassie.
Thank you.
Thanks for joining us on the MS Boost. Let us know, have you had stem cell therapy either in Australia or overseas? Check out the show notes for more details and catch up with a new episode where we discuss talking with teens about a parent's diagnosis. We'll see you next fortnight.